A ship is stranded in the Atlantic. Passengers are locked in their cabins. 3 people are dead. Doctors in full protective gear are being airlifted in. And at the center of it all is a virus that most people have never heard of. One that kills nearly 1 in 3 of the people it infects, for which there is no vaccine and no cure. This is not a movie plot. This is happening right now. As of this week, international health authorities are tracking an active outbreak of Hantavirus aboard the MV Handius, a Dutch expedition cruise ship that departed Ushuaia, Argentina on the 1st of April with 175 passengers and crew. As of the 12th of May, there are at least 11 confirmed or suspected cases across more than 13 countries. 3 people have died. The U.S. Centers for Disease Control and Prevention, the CDC, has classified this event as a Level 3 emergency response. The World Health Organization has activated international contact tracing protocols spanning countries from Argentina to South Africa, Germany, the Netherlands, the United Kingdom, Switzerland, Spain, and beyond. And here's the detail that is stopping scientists in their tracks. The strain responsible is called the Andes virus, and it is the only known hantavirus that can spread from one human being to another. This content is educational and does not replace medical advice. If you believe you have been exposed to hantavirus, seek immediate medical attention. Most people, if they have heard of hantavirus at all, picture a rural disease, something contracted by farmers or hikers in areas with heavy rodent infestations. That assumption is being challenged in real time by this outbreak. The passengers aboard the MV Handius paid between 14,000 and 22,000 euros for their berths. They came from Spain, France, the United Kingdom, the United States, Germany, and more than a dozen other countries. They were on a luxury expedition cruise through some of the most remote waters on Earth. And at least one of them, most likely exposed while visiting Argentina or Chile before boarding, unknowingly carried the Andes virus onto the ship. What followed has forced researchers to confront an uncomfortable question. If the Andes virus can move between human beings in a confined space, how different really is the picture from the early days of another respiratory pathogen that the world was also slow to recognize? The WHO is clear. The current global risk is assessed as low. But the scientific community is watching this outbreak with unusual attention because the Andes virus is operating at the edge of what we understand about hantavirus transmission, and because the gaps this event is exposing are ones the world has seen before. Hantaviruses are a family of roughly 20 viruses carried by rodents. They are not new. Their discovery dates to the Korean War in the 1950s. The World Health Organization classified them in 1987, but it was not until a 1993 outbreak in the United States, in the area where Colorado, Utah, Arizona, and New Mexico meet, known as the Four Corners, that hantavirus pulmonary syndrome was first formally described as a clinical condition. Before that outbreak, the disease had gone unnamed. In Asia and Europe, the predominant hantavirus strains cause hemorrhagic fever with renal syndrome, attacking the kidneys and blood vessels. Fatality rates for those strains run below 15%. In the Americas, the picture is far darker. The New World strains cause hantavirus pulmonary syndrome, a disease that attacks the lungs and the heart simultaneously. It can progress from what looks like an ordinary flu to complete respiratory failure in under 48 hours. According to Stanford Medicine, 35% of hantavirus cases in the United States over recent decades have ended in death. The Andes virus carries a case fatality rate of approximately 40%. 4 out of every 10 people who develop hantavirus pulmonary syndrome from the Andes virus do not survive. There is no antiviral drug that specifically targets it. There is no licensed vaccine anywhere in the world. Treatment is entirely supportive. Oxygen therapy, intensive care monitoring, mechanical ventilation to keep the lungs functioning while the immune system attempts to control the infection. Early access to a full intensive care unit is the single most important factor in survival, and even with that, the odds remain brutal. The virus entered the MV Handius in silence. A 70-year-old Dutch man developed symptoms on the 6th of April, less than a week after the ship departed port. He died on the 11th of April. At the time, his death was attributed to natural causes. No diagnostic samples were taken, no alert was raised. The ship continued its voyage through the South Atlantic. He is now believed to have been patient zero of this outbreak. His 69-year-old wife disembarked with 28 other passengers on the 24th of April at St. Helena, a remote British island territory, and later tested positive for Hantavirus. She had been living in close quarters with her husband during his illness. A German woman developed fever on the 28th of April. She presented with symptoms of pneumonia. She died on the 2nd of May, still aboard the ship. Her body remained on the vessel for days. A third death followed. By the time the WHO was formally notified on the 2nd of May, the virus had already crossed the Atlantic, carried silently by passengers who felt well enough to board international flights home. That incubation period is part of what makes the Andes virus so difficult to contain. The CDC notes that symptoms can appear anywhere from 4 to 42 days after exposure. A person can be infected, travel internationally, spend time with family, attend events, and show no signs of illness for weeks. The European Center for Disease Prevention and Control, the ECDC, has stated clearly that infectivity appears highest on the first day of symptoms, and that transmission shortly before symptom onset cannot be ruled out. That is the window that most concerns epidemiologists. As of this week, the situation spans multiple continents. A 65-year-old French woman who had been on the ship is on an artificial lung in intensive care in France. A Spanish national is quarantined in a military hospital in Madrid. 18 American passengers are being monitored at medical facilities in Nebraska and Atlanta. One tested positive, another showed symptoms during the repatriation flight itself. The ship's own doctor tested positive for hantavirus. So did a ship guide. Both were medically evacuated to the Netherlands by air ambulance. Contact tracing is now active across more than 20 countries. Spain coordinated the final docking of the vessel at Tenerife, in the Canary Islands, citing a moral and legal obligation to the passengers still aboard. This is what a contained but serious outbreak looks like in practice. Not a single epicenter, but a web of exposure events spreading across continents, each node requiring its own quarantine protocol, its own diagnostic test, its own chain of international communication. Now, pay attention. This next section may be the most important information in this video. The early symptoms of hantavirus pulmonary syndrome are nearly identical to influenza. Fever, fatigue, muscle aches, especially in the thighs, hips, and back. Headache. In approximately half of patients, nausea and vomiting also appear in this early phase. There is nothing in this symptom cluster that would immediately signal danger to most people, or to most clinicians, without a clear exposure history. Then, 4 to 10 days after symptom onset, the disease pivots. It pivots fast. The lungs begin to fill with fluid. Severe shortness of breath appears without warning. This is the cardiopulmonary phase, and it can escalate to complete respiratory failure within hours. Death, when it occurs, typically happens 2 to 10 days after symptom onset, and it happens suddenly, not gradually. If you develop sudden severe shortness of breath after any recent travel to South America, or after any known or possible contact with someone connected to the MV Hondius voyage, do not wait. Do not monitor symptoms at home. Go directly to an emergency room and tell the medical team, "I may have been exposed to hantavirus." Those specific words change the clinical response immediately. They change the protective equipment the team will use. They change which diagnostic tests are ordered. They change how quickly you are escalated to intensive care. Say them at the front desk before you sit down. The warning signs requiring emergency attention without delay. Sudden fever combined with intense muscle pain following potential exposure to an infected person or rodent-contaminated environment. Difficulty breathing developing within days of a flu-like illness. Pressure or tightness in the chest during or after a respiratory illness. A rapid decline in the ability to breathe while lying still or at rest. Confusion, disorientation, or extreme weakness alongside respiratory symptoms. These are not situations for a scheduled appointment with your doctor. They are emergencies. There is no home treatment for hantavirus pulmonary syndrome. There is no supplement, no herbal remedy, no over-the-counter protocol that addresses this disease outside a hospital setting. The only preparation available to you is knowledge. The only protection is speed. If you traveled to Argentina or Chile in the past 6 weeks, inform your primary care physician proactively, even if you feel completely well. Ask them to note the potential exposure in your medical file, so there is a reference point if symptoms appear later. If you were in contact with someone connected to the MV Hantavirus voyage, contact your national health authority and report the potential exposure. Protocols are active. You will be monitored and supported. The Andes virus is not a new pathogen. It has been known since the 1990s. Human-to-human transmission has been documented in the scientific literature for years. And yet, as of today, there is no vaccine in clinical use, no licensed antiviral drug, and no rapid diagnostic test widely available outside specialized research laboratories. The WHO and ECDC have both assessed the current global risk as low, based on solid evidence that the Andes virus spreads far less efficiently between people than influenza, measles, or the coronavirus. Researchers are not sounding a pandemic alarm, but they are asking questions. What happens if this virus acquires even modestly greater efficiency in human transmission? What surveillance infrastructure exists in the endemic regions of South America? What happens when the next exposure event does not occur on a ship with a passenger manifest and an international response team, but quietly in a city, among people with no travel history to flag? These are open questions today. Open questions in infectious disease are the ones that deserve the most attention before they become closed ones. What you know now, most people do not. The name of the virus, the name of the ship, the fact that there is no treatment and no vaccine, the fact that early symptoms are indistinguishable from the flu, the fact that the window between first symptoms and respiratory crisis can be measured in days, not weeks. The fact that speed, not heroism, not special knowledge, just speed, is the variable most likely to determine whether someone lives. Leave a comment below. Had you heard of Hantavirus before today? It tells us whether this information is reaching the people who need it. If this video helped you understand something the news has not fully covered, subscribe. This channel covers what matters for your health before it becomes a front-page story. And share this video with someone who travels, with someone who has family in South America, with someone who is older and has less physiological reserve to survive a pulmonary crisis without warning. Stay informed, stay prepared. Your health is not a given. It is something you protect every single day.